Just give me a moment. Can you see my screen? Is it visible?
Yes, sir. Yes, sir. It's visible.
Yes, sir.
Yeah, thank you. Yeah. Very good evening. Thank you for nice introduction from Vaishnavi, and I thank to Rajeshwari Garu. And first of all, I should thank to Aparna Alluri and who asked to take this session initially. Then Dr. Bharat Garu and other people from APA India. So this is my first lecture in APA, and he asked me to take a session on well-being week. Then I thought, so maybe all psychologists usually talk about different kinds of well-being topics. So I want to search for a unique topic, and it should be useful for all psychologists, especially. So then I I got an idea that so why don't we talk about psychologists itself? So we worry about and we take care about people's mental health, but what about our mental health? So many people have a question: is it really mental health professional has mental health problems? So that is the reason I choose my topic as psychologist heal thyself, well-being in the mental health profession. So as Vaishnavi said that I am a academician by profession, and I do take different kinds of training programs and all in my career. And so now we'll go for a session, and it's an interactive session. No problem. You can interrupt in any time. You can ask your questions, or maybe they will also provide some time to ask questions. Maybe you can also write down your questions, and you can ask me at the end of the session also. So it's up to you, your wish. And now,
Sir, we have Q&A session in the end.
yeah,
Once you finish our session, we will have a Q&A session.
thank you, Vaishnavi. Yes. Okay. So I start from here. In the world of existence, so nobody is superior and nobody is inferior, but nobody is equal either. People are simply unique, incomparable. You are you, I am I. The quote given by Osho, but it's a unique quote. So nobody is superior. And even we used to see different people that, people might be having a feeling of that superiority and inferiority. But in the world of existence, we are all equal. At the same time, we are all not exactly the same also. So it's every individual is unique in nature in this world. Every individual's personality is unique. So we can't find two people are same in the world. And then, so mental health practitioner. So when we talk about mental health, so we have a lots of questions. Who are comes under mental health, and who? Some people used to say that psychologists are comes under mental health practitioners. Some people used to say that only clinical psychologist comes under this, and some doctors are say that psychiatrists and neuropsychiatrists. So usually, what mental health practitioner used to do? The mental health practitioner is often the lead member of a mental health care team. Yes, based on their qualification, based on their profession. And so harnessing lived experiences may be considered as a precarious investment. So when we talk about harnessing lived experiences means that we used to deal with different kinds of problems and using personal experiences. And it's a precarious investment. Yes, we used to invest our um, risky behaviors, which means that it's a risky investment. Many people think that psychology is a passionate subject. Everybody used to attract to the psychology. Everybody, they are more passionate and they're more. Um, this is a dream subject for everyone. But the thing is that it's a precarious investment. So you need to be take care, and we need to invest with the risk of life, with the risk of various what do you call it as different kinds of experiences. They may feel concerned about losing authority or blurring the boundaries between professionals and patients. We really take care about subjects. I don't want to call patients. I just mentioned here, but I call them as a clients or a subjects. So when we are talking about mental health practitioner, he really cares about clients. We dwell into the client's problem. We swim into the client's problem. We are into the client's problem, and we experience their problem, and we are engaged with their problems. So it's a risky investment. That is the reason I want to say it's a precarious investment. And then, so who are mental health professionals? Maybe you have a question that, sir, these are all we know, but I just want to mention. So mental health professionals means immediately we used to remember the first one is psychiatrists and neuropsychiatrists. So when we say psychiatrists are medical doctors. They have completed their MBBS and then they go for a diploma or maybe a PhD. And then immediately our group will come, psychologists, therapists. Maybe in these days we used to hear different names. Psychologist means again there is a counseling psychologist, clinical psychologist, and psychotherapist or other therapists. And there are new names also. People are inventing new names also. So we'll take it as whole as a psychologist and therapist. So these psychologists and therapists are those who have completed their masters in psychology, and also maybe some people are completed their doctorates, and some people they completed their MPhil, Master of Philosophy and all. And one more important professional is psychiatric nurses. So many people are not aware of psychiatric nurses. Maybe we get to know about nurses, but psychiatric nurses are worked in mental health hospitals. Like, maybe we not in small cities. Maybe if you go for Visakhapatnam, in Pedavalteru, there is a mental health hospital. So there you can find psychiatric nurses. So these are specialized in psychiatry because they know how to deal with psychiatric patients and all kinds of, either it could be a severe patients or mild or moderate, whatever it is. And the other professionals are psychiatric social workers. So maybe we used to hear, we used to see social workers in the society. There are different kinds of social workers, especially in universities. There is a course called MSW, Master of Social Work or Masters in Social Work. But there is a specialization in final year, which is called psychiatric social workers. So what they will do, they will also serve for psychiatric people in hospitals, and they used to work in different kinds of scenarios where psychiatric needs are important. And the most important in psychology community, that is clinical psychologists. So there is a fight between psychologist and clinical psychologist always, and people used to say that you have to do that, you should not do this, or maybe there is a small gap between counseling psychologist and clinical psychologist. but clinical psychologists are RCA recognized, and they may have MPhil in clinical psychology, and they are certified to do some kind of procedures in the counseling and psychotherapy. And there is another profession called rehabilitation psychologists. So, as like clinical psychologists, there is a specialization called rehabilitation. So, these people are more into the rehabilitation. For example, in Andhra Pradesh, maybe we can say that in combined Andhra Pradesh, there is an institute called NIMH, National Institute of Mentally Handicapped, in Secunderabad. So there is a course, MPhil in rehabilitation psychology. So the people are more about rehabilitation of children, rehabilitation regarding to drug addicts, alcohol addicts. Rehabilitation have different kinds of specializations again. So these are also comes under mental health professionals. So maybe you may ask questions, sir, only these six? There are different approaches also, different kinds of other branches. Like I can say, we all hear that recently the cancer patients are increasing. We used to call, there is a course in psychology that is psycho-oncology. So we call them as a psycho-oncologist. So they are also psychology background. They are also comes under mental health professionals. And there are many other areas comes under mental health professionals. So these are all you know, but I just want to remind you because I am taking session on mental health professionals. Don't mind. So it's just I just want to tell you these are the different professionals or comes under mental health profession. Now, challenges of mental health profession. So in the society, many people think that psychologists are supermans or psychologists are superwomans. They don't have problem. They're always smiley. They always, listen to anyone. They always compassionate. They always accommodate people. They always enjoy their life. So they feel that we are all happy people. We are all enjoying our lives in every minute. Is that so? Is that so? Is that real? No. We are all, after all, human beings. Though we are a professional psychologist, maybe you are well in your subject, you are also a human being. So generally, there are different challenges of mental health profession. So what these challenges? So when we see, just observe the PowerPoint, or maybe you can listen me that would be better. So mental health professionals can also get affected or emotionally drained by continuously listening to clients' traumas. I used to ask my students and other people that why you are joined psychology. They always say psychology is a passionate subject. And some people used to say it's a crazy subject. Yes, but the thing is, it's a full of problems. If anyone comes to you to share their happiness to you, no, not at all. Never. They will come with bundles of problems. They will pour on you. You have to dwell in those problems. You have to experience, you have to listen. You have to listen. Problems only. There is no other chance to you. You have to listen n number of problems. I used to remember a cinema called in one movie. She used to say, the book, the entire book is problems. The math test book. The movie called Bommarillu. So the book is full of problems. So the psychologist life is no. I am sorry. The psychologist profession is full of problems. So we used to listen a lot of traumas, lot of stress, lot of problems. And working through one's stresses and mental health challenges can be tough. Yes, it is a tough job. It's not an easy job. The, the client used to come and you just listen their symptoms and write it down some prescription. It's not like that. You have to listen them at least 45 minutes, minimum 45 minutes. The entire session, 45 minutes, you have to listen their problems and you have to analyze it. You have to empathize it. You, you have to, understand those problems. So this is a tough job. And people may have stress, burnout, professional impairment are prevalent among mental health professionals and can hurt their clinical work. Yes, we do have stress. If someone says that I don't have stress, so he's faked. He's lying. He's lying. Definitely, he's lying. Everyone, I have more than 18 years of experience in psychology, and still I do have stress. Yes, we have stress, we have burnout. Sometimes we have a professional impairment also in a rare condition if you are unable to manage. And it can affect your professional work as well as it will affect your clinical work also sometimes. So I'm not saying that every individual will experience stress, burnout, all these in every day. It's sometimes you may have to experience um, in one time or more than situations. And mental health practitioners work in a culture of one-way caring. Please try to underline this word. It's a one-way caring. There is no two-way. For example, if you are married, there is a caring in two ways. So you have to care your partner, partner will care you. If you joined in an industry, you have to care about your industry, the industry will care about you. But when it comes to mental health, it's one way. There is no traffic. You have to go on, you have to go on, you have to move on with the problems. Underline this. So it's a one-way caring in which they are required to demonstrate empathy. Yes, we need to demonstrate empathy, compassion, and patience without the expectation of receiving any such care return. No client will empathize with you. No client will show sympathy on you, or empathy on you, or compassion on you, or patience on you. Client needs what client needs? Client needs, they want to come out from their problem. They want to free from their problem. But they don't care about mental health professionals. Maybe some people smartly they said that, sir, we are paying money, no? Maybe you may pay money, but money is not a matter. It's when comes to the mental health. So you need to be take care. And I'll tell you a study which was happened in 2011 by Philips. Most mental health professionals seek personal psychotherapy at least once in their career. Yes. So even if you find any difficulty, no problem. You can call me, you can take the therapy. I'm just joking. Maybe you can go for Krishna Bharat Garu or maybe other people also. So, which is, a kind of, everyone needs therapy in their life at least once, maybe sometimes we need multiple times also, and at much higher rate than the general population. So, when we compared with the general population, psychologists prone to more problems. So we do experience some distress in our life. Maybe some professional need to help to you. Don't think that we always help people. We don't need help. So please think that you are ready to take session also sometimes. Don't worry. We'll see how it will go on. And then Sorry. Yeah. So, what are the risk factors for psychologists? I think many, I mean, based on the previous slide, we just see the risk factors. Whether psychology professional is in risk or not. Yes, definitely. So, the risk factors when comes to see, the first one is burnout and therapist fatigue. Yes, psychologists usually get burnout due to because of long working hours and listening continuously different kinds of problems. And therapist may get fatigue. You know fatigue, right? We used to get fatigue because of listening again and again and again and again, full of problems. So sometimes there may be history of personal trauma also. Even we are a psychologist, maybe we do have personal trauma. Maybe we have some problems in family. We have some problems with elders in the family or any other kind of problem. There would be, there may be, there could be, or you may experience problem in your life. So that is also a risk factor for psychologists. And when it comes to the second point, which is stress, anxiety, depression, it's a common terms which we use in our practice, in our regular life. Stress, anxiety, depression. Even these days, very much people are using these words in general terms also, especially the youngsters, the teenagers and all. They said that I am depressed. Even they don't know what is the meaning of depression. So, but this is another prevalent symptom of distress in psychologists. Yes, psychologists may experience stress due to because of any reason. I don't want to mention all kinds of reasons, but any reason. We may have anxiety sometimes. Maybe if you're a type A personality person, you may have anxiety. But if it is not also, maybe you may have sometimes state anxiety or trait anxiety, or sometimes generalized anxiety due to because of your professional and personal issues. Depression can be happen because when you have more work hours, if you are isolated from the society, then maybe you have depression. So we'll see. The third part, the third one is vicarious traumatization and compassion fatigue. Yes, the phenomenon that can affect mental health providers, cognitive, affective, and behavioral. So there is a concept in psychology which means cognitive, conative, affective, triology of mind. So people can, these three are interrelated, and these three are interrelated and interdependent, and it will affect your um, what you call it as personal. Sorry, it will affect any professionals or maybe any person. So vicarious traumatization means that we exposure to generally exposure to we expose to trauma, we understand trauma, and we are the secondary traumatic stressors. Why I am saying secondary means who is the primary? The client is the primary one to experience the trauma. Then who is the secondary? The psychologist, the counselor. He is the person who experienced trauma in a secondary level. So our job is, vicarious traumatization and compassion fatigue. Yes, I do hear uh, many psychologists used to have some problem with the family because they are this a fatigue listening, empathizing, understanding. So they will, sometimes they'll get fatigue and there is a disturbance with the family or maybe colleagues, and maybe it depends. And the fourth one is poor self-care. So what is that? Poor self-care. So what do you mean by poor self-care? Yes, we psychologists are very poor at our self-care because of overworkload, because of paucity of leisure, which means we don't take breaks in between, and non-work activities. So poor self-care means that don't think that only physical self-care. So we need to have some breaks in the counseling sessions, in between sessions, and we need to have a kind of leisure activities also. And I used to see some psychologists, they used to see 8 cases, more than 6 cases. So which means that uh, they're in danger. Maybe you may ask me, sir, if we take more sessions only, we'll get money. Yes, money is okay, but your health is also important. Especially your mental health is important. Understand? So we need to take care. That is also one risk factor. And relationship issues. Yes, it is due to countertransference, burnout, and emotional exhaustion, lacks in spending time with family. So maybe maybe people may know about countertransference.
ఇప్పుడు ఉండేవాడు కదా అవునా?
Can someone be silent, please?
లాస్ట్ వరకు ఉండేవాడు, అందరూ వెళ్ళిపోయినాయి.
Hello? Okay. You may hear the word countertransference. It is a important topic in counseling skills, transference and countertransference. And some people maybe some clients show transference, and sometimes the mental health professionals may show countertransference. They may attract it to client. They may feel client like their family member, or maybe some kind of attraction. So this is a problem, relationship problem. And burnout, if they have more burnout, they will show the burnout levels at home. Emotional exhaustion, yes, people used to got emotional exhaustion, and because of these, they're unable to spend time with the family. So even though you are a psychologist, you should remember you have a family. Maybe some people may say that, sir, I am single. Even if you are a single, you have parents at home, you need to take care, you need to talk to them, you need to spend time with them. It helps you to come out from this burnout and other stressors. So these are the risk factors generally psychologists used to face. And then there are some warning signs. So you understand the risk factors, but these warning signs help you to recognize, is there any risk factor or not? So what are the warning signs? Generally, I just minimized, there are n number of warning signs, but these are the major things. The 8. One is loss of pleasure in work. I used to see some of my students and some of my colleagues or my juniors, they just do counseling like with very monotonous. So they don't have pleasure in their work. They don't enjoy, because they said, sir, I have more clients. Recent days, some therapy centers and all, they used to give 10 sessions, 12 sessions per day. And my students used to told me that, sir, it's very hectic to take more than 10 sessions. We are not enjoying the pleasure of working. So it should be ideal. So many people may face this kind of situation, loss of pleasure in their work, and inability to focus on the work. and inability to focus on their regular activities. Maybe we are all faced somewhere around, maybe in your life or maybe in regular life, uh, in your regular life, we have a concentration problem. And the most common thing is that forgetfulness. We used to forget mobile phone. We used to forget lunch pack. We used to forget some documents and all. So maybe we think that it's happened. Especially professors used to think that professors used to forget the things. Then he is not a professor. Otherwise, he is not a professor. It's not like that. People used to forget means that he is in stress. There must be some stressors. There must be some, I don't say the word burnout, but they have stressors, or maybe they have uh, more work than their capacity. So that is inability to focus on their work or their daily activities. And so when it comes to, some people feel anxious related symptoms, depression related symptoms. I don't want to mention because you are all very well known about these symptoms and all. So people may have anxiety symptoms, and we recognize sometimes, we do have a kind of uh, breathlessness, or maybe a heart pounding, or maybe tension, or these kind of things. And at the same time, people may have some depressive symptoms. Those are also warning signs. And the fourth one, substance use. Don't mistaken me. Don't think otherwise. I know some psychologists and professionals, psychiatric or mental health professionals. They used to have different kinds of habits, and they will give a reason also. Sir, morning to evening, I used to see cases, no, sir. So evening, I'll just take this much, sir, for refreshing or for getting good sleep. Substance use, or either it could be alcohol, smoking, or any kind of drugs. Even I used to see some people, they used to use medicine for sleeping and all. So it is advised to control your client load rather than taking such kind of doing such kind of activities. So maybe some people may ask question that, sir, taking some alcohol is sin. No, I don't say it's a sin, or I don't say it's a something bad behavior or something. Maybe you are the right person to judge yourself. You are the right person to take right decision. So maybe it depends upon you. It depends upon your what do you call it as um, your ideology, or maybe your interest. So that's for substance abuse. I don't want to stretch more. And the fifth one is workaholism. There is a uh, alcoholism, like there is a workaholism. I used to see some people, they are like, they just born for work only. They feel from the morning to the evening, they keep on doing work. They keep on doing work. They are engaging work. They don't have time for themselves. That is the reason they are isolated. Isolation means they don't want to communicate with the colleagues because they are busy with their works, and they don't have any social relations. They don't have any, I can say, uh, any leisure activities, or they keep on doing work. So at the end, we can find we are alone. That is isolation. Maybe they said, sir, in work, while doing work, I used to communicate many people, sir. Yes, you may communicate with n number of people, but still you are alone. You communicate with the people regarding your work. You don't ask anything, how are you, what are you doing? So these kind of things you cannot find. So this is the fifth point. And sixth one, persistent thoughts about clients. This is a beautiful symptom, I'll tell you. Maybe my students used to tell me that, sir, while I'm doing bath, I am remembering the case. Sir, while I'm eating, the person is came to my mind, sir. He is haunting. So it's like what do you call it as a horror movie for me, because wherever I go, he is haunting. So which means that people may get persistent thoughts about the clients. Even when they go for washroom, they think about the client, how to deal with the client. Even they go for shower, or even they go for temple, or even they go for cinema, movie. So this is the biggest warning sign. Persistent thoughts about the clients. Yes. If you feel so, please call me. Right? So I'm just joking. So persistent thoughts about the clients. This is the major warning sign. And the next one is chronic irritability and impatience. So if you want to know about your behavior, you just go and ask your family members. You just ask your partner, what is your behavior? How much irritable are you? How much impatient are you? So when we are talking about warning signs, people may have these kind of uh, issues with the mental health professional at home. You may not show your irritability and impatience with the clients because you are a psychologist. Maybe some people used to say, I'm a born psychologist. So what? So if you are a born psychologist, so you need to maintain your emotions with your family and client in the same way, in the balanced way. Maybe you may have emotional exhaustion sometimes. You may have emotional irritability sometimes. Then you have to overcome those symptoms using some kind of method. You should not show on your family members. So that is very much important. And the last but not the least means increased cynicism. Increased cynicism means that negative beliefs. Overgeneralized negative beliefs. Sometimes we believe we believe negatives in a generalized format. We generalize things because you are um, a person, those who are dwelling into the problems. So sometimes even it is a negative beliefs also we generalized. I'll tell you, many people are having crush on psychologists. Yes, because we don't get such kind of partner in our life. Those who listens like that, those who empathize like that, those who understands like that, those who adjust like that. So, but when you go and inquire at home, they will tell you the reality. So, people may have such kind of warning signs in their lives. So we need to be take care. We need to be understand what are the warning signs we may face in our life. So it is common to have these kind of warning signs. Don't think that I don't have any kind of problem and all. Every individual has to face in their lifetime, in their professional life. Yes, no one is exceptional, including myself. So we need to be more cautious. We need to be more conscious. Then there is a concept called wounded healer. Maybe have you heard or not? I don't know. Even if I ask question also, it's difficult. I'll go on. Maybe at the end we will discuss. Wounded healers. And maybe there is a book called, I think, Wounded Psychologist. People used to have different kinds of problems, even starting from Sigmund Freud and other people also. And when we talk about wounded healers or mental health professionals, often psychologists, psychotherapists, or any other professional who draw on their own experiences of pain, trauma, or mental health challenges to better understand and help their clients. So this concept was um, popularized by Carl Jung. It's there before, but it was popularized by Carl Jung. Suggests that a therapist's wounds can foster a deeper empathy and connection with those they treat. So before discussing this, I just want to tell you, I used to see many people, those who are joined for psychology, and I observe from my career beginning also. And even when I was in Andhra University, we used to have lots of distance mode people. More than 100, now it's more than 200, but that time it's more than 100. And I used to observe people because I am a psychologist. And in 100, at least 20% people are having some kind of problem, psychological issue. So they have some kind of stigma to visit the mental health professional. So then they will join psychology course to understand their behavior. So if they completed their courses and if they start doing counseling and all, they comes under this concept, wounded psychologist or wounded healers. So which means that if a psychologist having any kind of um, wounds, or which means that any kind of trauma or a pain in their past, it can help to understand clients more. This is the concept given by the Carl Jung. But the thing is that recent days, one professor interacted with me, and he is from I think English or something. He simply says that, sir, I have seen many psychology professors, but their end is tragedy. So I have a question whether he is warning me or maybe he is giving hint to for my life. I just asked him, sir, sorry, can you repeat the statement again? I have seen many professors, and he quoted one or two names also. So their end is like, it's not normal. They have some problem at the end of their life after retirement and all. So I asked him, so what kind of problem? They're not mentally fit, sir. They have some disturbance. Sir, not all literature people are Shakespeare's. Not all psychology people are comes under this category. It's based on your personality, it's based on your circumstances and the society. Society means that the environment. So not maybe comes under this category, but please don't generalize. So maybe you have your opinion. Please keep your opinion with you. And I just say bye to him, and I go on with the party. So people have such kind of opinions. And some people may think that, no, I don't want to talk much with you because you are a psychologist, you read my mind. So I said, sir, this is not a movie, this is not a Chandramukhi cinema or something else. So psychologist means that we do understand your behavior, but we need some time, we need to take some interaction with you and all. So people have different kinds of opinions. So this is the concept wounded healer. I just want to introduce you to understand. And then, sorry. Yeah. So if psychologist has problem, deterrence to seek help, what keeps psychologist or any mental health professional from seeking help? Obstacles, or maybe we can say, what do you call it as, prevents you to take the help from the people. Or research has identified several barriers. So why I am saying research means that it's safe side for my sake. Maybe people may ask, sir, do you have proof for this, proof for that? And so it's already done vast research. And I have also done research when I'm studying Master of Philosophy in Andhra University. So the first one is social stigma. So we don't want to visit others mental health professional because of stigma. Fear the stigma of seeking help, believing they may be viewed negatively by family and friends. Yes, even my wife used to use those words that you are a psychologist, why don't you understand? So you are a psychologist, why do you have these kind of problems? You are a psychologist, you should be different from others. So it's not like that. Even though I am a psychologist, I am a human being. And people may feel maybe we have a stigma due to because of how the people will think about ourselves. And as well as by the clients. Sometimes, if you go for therapy or if you go for help from your friend or someone or senior or someone, maybe you may feel that maybe if my clients saw me at that place or how they feel, or maybe if employers and colleagues who may have questioned the ability of my psychology, what do you call it as strength. So we may feel that maybe people will question my existence. People will question my capability. People will question my capacities, my knowledge. So that is the social stigma to seek the help from the other professionals. So many psychologists used to have this kind of problem. And other one is treatment fear. So treatment fear means that privacy may also be a major concern. Yes, maybe if I go for Krishna Bharat Garu, I have a doubt whether he will tell to all APA members or not. Or maybe some of my friends, colleagues are there in Vijayawada. Sometimes if they met, maybe Narayana came to counseling for me. It's a proud for him, right? Maybe I'm sorry, sir. Just I'm giving example. So this kind of treatment fears will be there in psychologists. The fear of being seen sitting in a psychologist waiting room may be enough. So, and the other one is fear of emotions, competition among practitioners. So, I am a popular person in the Andhra Pradesh, but if I go for seeking help from others, maybe what about my um, what you call it as recognition and reputation, which could interfere with the psychologist's ability to establish a safe and trusting relationship with his or her therapists. And the other one is self-disclosure. So when we say self-disclosure by mental health professionals, with therapist is a complex issue. The major risk may be relationship issues, disturbance in workplace culture, disrespect, name and fame, and derogatory self-confidence and concept. So people may have fear of self-disclosure and they don't want to disclose themselves. And the last one, yes, many people face this problem, lack of time and resources. And some people used to say that, sir, I don't have time to meet my friend or my senior or my guru or my mentor or something. And they may also say that, sometimes Sir, I am getting very less doing this counseling and all. But again, I have to invest on me. It is a big challenge for me. So these are the other no deterrents to seek help or preventing to seek help. So these are common and a career, which means that lack of time, resources, self-disclosure, fear of emotions, social stigma, and treatment fears. These are the common deterrents to seek help. So hinders. I mean, there is a a kind of blocks to seek help. And then if we go next, yes. So we see if you ignore. I just want to say you means that mental health professionals. If mental health professionals ignore, what will happen? The consequences. So maybe it is very harm to self. Maybe they may have depression. They may have social or professional isolation. They may have job dissatisfaction. They may have suicidal ideation. I'm just saying may have. So I'm not confirming anything. They may have relationship conflicts at home or maybe at workplace. And some people are having addictions and some people are unprofessional behaviors. Yeah. And some, I used to see some psychologists, they used to have perversion also. I'm sorry to say this word. I have seen many, not using many word is not good, but there is a perversion in psychologists also. So it is we need to take care about ourselves. And there is a ethical violation, and some people they violate the ethics and no. I think maybe you're all know about and ethics and values in counseling. It's a separate, a big topic in counseling. And ethical violation, stress-related illnesses may face, and it leads to defame in society. Yes, they may have bad name in the society, negative publication in the society. So these can be happen if you ignore your occupational hazards. At the same time, if you ignore occupational hazards, it can also be affect your clients, harm to clients. Yes, if you are not mentally fit, if you are not, if you are having any mental health problem or any symptoms also, it will affect your clients also. If you are burnout, how can you take care about the client at the end of the day? So that is also very much important. So client may have, I mean, they have a difficulty of malpractice, transference, boundary violation, loss of faith in therapy, symptoms exacerbation, and guilt and laterogenic symptoms, despair, which means loss of hope, relapse the problem. The problem may relapse again. They may experience the problem, and sometimes they may have suicidal ideations also. Because when you are not okay, your client has problem. It will increase their severity because you are maybe you may overcome those issues. Sorry, you may not consider their issues. You may be flow of thoughts. You may be having some kind of symptoms may be exuberation. Exuberation means that increase the symptom will increase, which means that your therapy will not work, but it will work as a worsen conditions, reverse way. So you should be very cautious while you are practicing psychology. And not only this, there is a problem with uh, the profession itself. There are some people, psychologists, those who are practicing counseling, Sometimes it will be happen due to because of lack of knowledge also. Some, they don't know what is counseling. They don't know characteristics of counseling. They don't know skills of counseling. They don't know what is the procedure of counseling. They don't know what are the different steps in counseling. But simply they start practicing. And some people may feel that counseling is just chit chatting. Some people may feel that counseling is just listen to them. Some people may feel that counseling is just giving advice. So not that it is not the way to um, practice psychology, learn psychology, understand the characteristics, understand the skills, practice it, then go for the society. Don't go blindly. So it will affect your mental health as well as clients' mental health will be exacerbated. I will tell you one statement here. If a doctor done a mistake, the patient will die. If a doctor done a mistake, the patient will die. If a psychologist did a mistake, what will happen? The society will affect. Many people think that only simple case, sir. No, it's not a case. The subject will go and disturb the family. The family go and disturb their workplaces. So it will go on like this. The stressor you send through the client will impact in a chain system in n number of people. So practicing psychology in a right way is suggestible. And maybe people think that it's a harsh words, not harsh words. It's from my heart. I'm not harsh. It's from my heart that when you want to practice, learn psychology. It will take 1 year, 2 years, no problem. You have ample of time. Don't hurry to make money because you will not sustain for a longer period. If you want to sustain, if you want to continue your legacy in the field of psychology, you should learn psychology completely. My guru used to told me that I just told him after my post graduation, sir, can I do counseling? So he simply says that, what do you learn about counseling? No, you need to learn more and more. Sir, I have completed my masters in Andhra University from the legendary professors. But still he said that no, you need to learn, do practice and do apprentice with someone, learn, read books, understand, then practice. So I started my practice after my completion of post-graduation. So still I learn things because every client is unique. Every client will learn you something. You have to learn many things from clients. So this is one part. So I just want to come to the matters first here. Consequences, because of if you are ignoring the hazards, it will affect your profession. They don't say only Narayana did like this. They will say psychologists are like this, sir. All psychologists are like this. Loss of credibility and some legal issues. I see some people they do what they I'm sympathizing with them. I'm not empathizing. I show sympathy on them because they don't know much. They just sit before the client and they say something. Whatever they want, they say something. I know I heard from one of my client that one psychologist he asked the client to come after head shower. What do you mean? Whenever he come to the counseling session, he need to do head bath. I was wonder what is the relation between head bath and counseling. So people are like this. I don't know because they don't have content. They will create the content like in YouTube. So there are some legal issues. There are some attritions, something weaker and destroying the name and fame of psychology. Negative media attention. Yes, we do see many things, and nowadays media is powerful. And cynicism, which is called distrust about psychology. People don't believe even Aaron T. Beck comes to give counseling also. I think everybody knows about the Beck, who is the father of cognitive behavior therapy. He survived 100 years. Please do quote his name if anyone says about psychologist and all. Psychologist can also survive till 100 years if you maintain all these. So cynicism, distrust about the psychology, and disillusionment, feeling of disappointment. Yes, if you pay for something, you will expect something. Yes, disappointment and hatred towards the profession. This is the basic thing. Many people, they have a hatred towards the profession. They simply generalize things. All psychologists are dash. I don't want to feel. Please feel whatever you like. They simply say no because they they go for one. They will generalize for all. Psychologists are like this, sir. We no need to go for it. Go to them. And people often struggle to believe and refer. And general people, when they don't believe, they don't refer to other one. So when you want to sustain in this field, you need mouth publicity rather than YouTube publicity or Instagram publicity. Yes, that is the success. I used to see my clients used to say, sir, someone referred you. So you feel proud because it's a recognition. It's like an award. And negative attitudes and beliefs, stigma will increase. Already there is a lot of stigma about mental health. People don't want to come to counseling and people don't want to visit mental health hospitals and all. But in such cases, the stigma will also increase. So these are the consequences. And then we'll come to, it's okay to take help from other professional. So don't feel bad to take help from psychologist or psychiatrist if it is needed. If it is needed. So most psychologists have had to heal themselves of emotional distress or self-defeating behavioral habits. Yes, we do have a capacity to deal with our problems. We'll discuss. And seeking professional help can prevent mental health issues from becoming more severe and complex. Yes, sometimes if you feel that you are unable to manage your symptoms, you can take help from mental health professionals. There is nothing wrong in that. Mental health conditions can worsen over time if left untreated. Yes. So don't get late. Don't take time to take the help. So better to visit whenever it is necessary. So leading to significant impairment in daily functioning and even suicide. We do hear some psychologists also committed for suicide because everybody used to have problems. So I have given 6 steps here. 6 steps. First step is self-monitoring. I just want to take water with your permission. Self-monitoring. So it is a technique in counseling. Maybe many people used to use for clients. Self-monitoring technique. Monitor yourself to identify your symptoms, to understand your behavior, to understand your routine, to understand your symptoms, understand and identifying. And then try some self-help techniques. we do have different self-help techniques. We'll discuss in another next slide. Try some self-help techniques. Yes. First, try with your self-help techniques. And then, if it is not worked, if you still have a problem, then you go for your mentor, guru, or colleague. Who is mentor? Maybe you are all under APA India. Maybe you can take help from Bharat Garu or any other known person. Maybe you may have gurus in your college times. Maybe you may have classmates, colleagues, or maybe well-wisher, and you can take help from them. And then, if it is not worked with the mentor and all people also, better to visit psychologist or a therapist, unknown person. These days, people are available in online also. So maybe you can approach anyone, or else maybe you can approach me also in through Practo or something, or maybe you can. So I'm just joking. So you can approach any psychologist or therapist, and even if your symptoms are worsen severe, better to visit psychiatrist or physician for medication. So don't think that psychologist no need to take medication and all. So even we have 2 legs, 2 hands, 2 eyes, 2 ears, one nose, one mouth, like all other people. Same physic, same kind of body. So everybody needs medication as and when required, not all the time, as and when required. So please to try to underline this word. Remember this word. It's okay to take help. It is okay. There is no any restriction. Please keep it in quotes. It is okay to take help in any condition with anyone, no problem. Then, so these are self-healing routine for mental health. Maybe you are all good at all these things, but because of my topic, I'm just mentioning all these things. So if you practice, I'm very happy. If you are not practicing, please try to practice these steps. Maybe if you feel difficulty to practice all, at least majority of number can practice. There is 8 points here. At least 4 can help you to be normal, happy. First one, exercise or any other physical fitness activity. Start your day with 30 minutes of physical fitness practice. You can do yoga, you can do exercise, you can do walking, or you can do brisk walking, or you can do what do you call it is that dance. What is that? Jumbo dance or whatever it is. Zumba dance. Sorry. So maybe you can do any kind of activity, at least minimum 30 minutes is enough. And the second one is you can use some guided meditation. I'm sorry, I am not reading the comments. I will read at the end. Okay. So maybe people may feel that Sari is not answering my question and all. So I'll answer everything. So guided meditation. So begin your day with a few minutes of guided meditation and deep breathing before you walk. Breathing exercises. Maybe you all know different kinds of breathing exercises and all. And mindful walks. So this is very much important, a new topic. Mindfulness is recent topic. So mindful walks means that maybe if it is possible, you can walk where you notice the different sights, sounds, smells, and other sensations around you. Maybe you can also walk in your cabin itself also. Keep some good plants, indoor plants in your office. Just give a mindful walk. You don't need to go for park and all. Again, it's a problem. So just walk in your compound or maybe cabin or wherever it is available. And set a daily intentions. You can set daily intentions. Maybe you can reminders in mobile phone, or maybe some people, I used to use sticky notes. So what to do today? So what is your intention today? You can write it down, and maybe you can complete as early as possible. And regular break for refresh. This is very much important. I will tell you my own practice that I used to take 5 to 10 minutes break in between the clients, in between the sessions. Definitely, because these 5 to 10 minutes, I just do something. Maybe sometimes the secret, don't tell to anyone. I used to watch reels also. What reels? The YouTube reels and also. I just want to refresh. I watch one or two just for a while, just refreshing. I will stretch. I will stand up and do some stretchings or walk for a while. And again, I sit and I'll go for next session. And daily gratitude journal. This is very much important. You should have a gratitude in every day. So what I have done. So maybe you can write it down somewhere. The books are available now. Maybe you can write it down somewhere in diary. People are forget to write diary. Even I am not writing diary because uh, till my marriage I used to write diary. But after marriage, my wife used to reading that diary, so I stopped writing. So, so sometimes it's a problem. Maybe if you are not writing the diary, just write journal. Journaling is very good. Maybe you can write 1, 2, 3 points. That's enough. It's just gratitude towards the day. And seventh one, the diet. Please do care about your diet. I don't want to take dry fruits or maybe salads and all, but eat healthy food consciously, and try to manage your food. What kind of food are you taking and all? See the portions of food and all. That would be good. Maybe you see many suggestions. Take protein and all. You just follow whatever there in at home. And the last one is very much important. Sleep hygiene. If you lost your sleep, I don't want to say any word. You decide. Prioritize your sleep. You should have minimum 6 hours sleep, sound sleep. And having a relaxing bedtime routine and getting adequate sleep. Maybe it is better to do shower before going to bed, and maybe have some glass of milk, or maybe do some breathing exercise before sleeping. Avoid gadget, mobile detoxification. We'll have some session on the mobile detoxification somewhere. Maybe either it could be from API or from Manas. So self hygiene, sleep hygiene is very much important. And then I have only 10 minutes time. I'll complete it. So I just want to tell you some quotes by popular people. In the world of mental health, the mind is its own place and in itself can make a heaven of hell, hell of heaven. It's by John Milton. So it's completely based on the mind is in its own place. The mind does not have any kind of, shifting or something changing and all. It's completely your wish, whether it is heaven of hell or hell of heaven. And your mental health is just as important as your physical health. This is by WHO. But the quote was given by Brock in as he was a chairman for WHO at that time. And taking care of your mental health is an act of self-love. Please underline and remember this quote. Taking care of your mental health is an act of self-love. If you love yourself, please take care about your mental health. And it is okay to take break and prioritize your mental health. Yes. And I don't mention some things that, for anyone who wants their mental health in a good condition, you need to take a break. Please go for outings, whether it can be devotional trip or recreational trip. I just tell me my personal. I used to go minimum 2 trips. One is devotional and one is recreational. Yeah, I will plan like that. Every year I will go for minimum 2, maximum it depends. So one is devotional, means maybe I'll go for Tirupati or maybe Kanchi or maybe Arunachalam, or maybe it depends upon your religion and all. I'm not insisting to go for that. So it depends. I'll go with my family. And one recreational trip, maybe we'll go for some Shimla or Ooty or something. Don't ask tickets and all. No? So it's based on your budget, and you can go for Arco also nearby, or even you can go for very near places also. So it depends upon your budget, and or maybe you can go for your friends' family's house, maybe relatives' house. You can spend 1 or 2 days and come back. It is gives you a boost like anything. Like you can refresh, and then therapist heal thyself. Yes, therapist can heal themselves. One is the psychological immune system. Excuse me, can I extend for a 10 minutes? Is it okay? Or can I?
Yes, sir.
Okay.
Okay, sir.
Okay.
Okay, sir.
Thank you. Thank you for bearing me. Psychological immune system, which is, so build immune system. You can build your own immune system. I'm not going to the details, but you have to prepare some core values. For every individual, you have to prepare some core values, and according to you act, then it is a kind of strengthen your behaviors. And emotion reconditioning. I will tell you, we used to give our car, bike for service. Yes or no? We used to give for service, no? Water servicing or engine servicing and all. So in the same way, you have to regulate your emotions also. You have to do some kind of using some kind of method, do some service, take some time and come back to your work. I have a friend of mine, my close friend, my classmate. She used to go long trips and she used to go for trekking. She used to call me, but she is single. I am with family, so it is difficult for me many times. But still, if it is possible, maybe you can go for trekking. And maybe she also visited Himalayas and all. And she used to take yearly twice, 1 week, 1 week gap. And this 1 week, no mobile phone, no contacts, no clients, no profession. And so detoxification from the society. So emotion reconditioning is also important. Emotion regulation is non-suppressing emotions. Regulation means that don't suppress your emotions. You have to ventilate yourself. You have to open up. It's changing the perception of stimulating the emotion, and the perspectives will change the core values based on core values. Usually by widening one's point of view, you have to widening your thoughts. You have to expand your perspective. Then you can easily regulate your emotions. Don't be narrowing your thoughts. Don't be tunnel mode. Better to expand, better to widen. Then you can regulate, you can recondition your emotions. And binocular vision, that's what. So you need to see the things in a binocular vision. Then it is very easy to understand whether you can take step or whether you can go it and whether you can adopt it. If it is monocular, you will have a problem. Binocular vision makes us want to learn and appreciate things. If it is monocular thing, it makes you want to argue and win. Don't argue. and don't try to win with the people. Give your opinion. They may respect, they will respect. Otherwise, they have their own opinion. Why should we insist someone to accept your opinions? So we are not a Trump, like, right? Trump is using many kinds of nonsense now. So we are not like Trump. We should be like Obama. So try to accept. We should be like Narendra Modi ji. So Modi ji, so he take different opinions from the people and then he used to do. Please don't mind if you don't like Modi ji and all. I like Modi ji. So it's a binocular vision helps you to understand and appreciate things. And last one is basic humanity. Yeah, sir, what do you think? Don't we have humanity? No, we do have humanity, but we have to apply in all cases. Basic humanity is an innate interest in well-being of others. Basic humanity motivates respectful, helpful, valuing, nurturing, protective, compassionate, and altruistic behaviors. In adversity, opposite, it motivates sacrifice. In emergencies, it motivates risks. So basic humanity means that you do your work, don't go beyond the levels. So some people in their career starting, even they used to communicate with the clients night times, early mornings. Sometimes clients used to torture the profession psychologist. They will call, doctor, I want to suicide now. So then you have to run behind the client. So you should have a basic humanity and you should maintain. So your professional ethics. So this is the heal thyself. And this is the important slide. Maybe if you like, you take it or try to read different books. There are n number of books. Maybe you can find it from free books also, PDF drive. Or maybe if you have any difficulty, just let me know. I will forward it to you. And the books, Autobiography Yogi and Sadhguru, Death and Emotion Relationships by Sadhguru is also good. Maybe you can just, if you have, okay. I'm not promoting them, just telling you. And Life's Amazing Secrets by Gaur Gopal Das, that is also a good book. And Ikigai, which helps you to practice Japanese lifestyles. And the most famous one is I Am Okay, You Are Okay, Kaizen, and games people play, which is more on emotional intelligence and all. And there is another book called The Alchemist. And this is a small book, Who Moved My Cheese? Wonderful book, very small. I think maximum 80-90 pages. Or Emotional Intelligence by Dale Carnegie. Highly effective people, habits of the 7 habits of highly effective people. How to win friends and influence people. This is also a good book, Dale Carnegie. And Atomic Habits. This will help you to change your routine. So there is no place to place many books here. I just given very few. Don't say that, sir. This is enough for us to read entire life. So try to read the book. At least it will take 15 days. Even if it will take 1 month also, no problem. You can read 12 books in a year. Even if you understand or not, try to read. This is usually I used to teach my students that, no need to understand the complete book. Try to read. Then you will get to understand somewhere. And whatever you learn, whatever you read, it will go and, stored in your memory. So this is about a few self-help books. And I will end up with with my quote. Taking care of mental health is a lifelong journey that involves both self-care and supporting others. And thank you. Thank you for listening me patiently without hesitation. And I'm very happy to see nearly more than 100 people. And signing off from my side. Thank you.
Thank you so much, sir. Thank you for sharing your immense knowledge with us. Especially, we could all resonate with the knowledge that you have shared. We could able to relate to all the things that you have said, sir. Thank you so much. If anyone has any doubts or you want to pose any questions to sir, sir, can we welcome the questions now?